Streaming.
Yeah.
Okay, thank you everyone for logging on and being here. We are recording the meeting and it is currently being live streamed to our Facebook page. Brian Williams and Patty, I'm going to turn it over to you at this time.
Go ahead, Patty, all yours.
Okay, good morning, everyone. Can you hear me?
Yes.
Excellent. Good morning, everyone. Good morning to our commissioners, our panelists, and our guests, and also to everyone who is tuning in on Facebook and online to attend our meeting today. The physical distancing is continuing to cause us to meet not in person, but virtually, and hopefully we keep getting good at this, and then eventually we'll be able to meet in person. I look forward to that day. I'm sure many of you do also. So I would like to start with taking our moment of meditation, of reflection. I'm going to ring the bell and ask you all just to sit in place and center yourself. Enter this space together for a minute of sitting quietly together, and also kind of reflecting on the fact that many people are dying through this COVID-19, and there's a lot of suffering, and we want to be able to acknowledge that, and our meeting today is going to be addressing some of that. So sit together. Now I would like to first of all, welcome Commissioner Ocean back. It's nice to see you. Nice to have you with us again. We missed you.
To be back. I missed you all.
Will Ingrid Williams please take the roll for the record?
Commissioner Bonner? Please say.
Yes.
Commissioner Vera? Commissioner Harris? Commissioner Rubin?
Yes, here.
Chair Giggins?
Present.
Commissioner Ochin?
Here.
Commissioner Kennedy?
Here.
Commissioner Tolentino?
Here.
Commissioner Thompson? Thank you.
Okay, I would like to say the Pledge of Allegiance. Maybe I'll ask Commissioner Rubin to lead us, see if we can chorus. See, I believe that that we do have a flag.
Oh, I pledge allegiance to the flag
of the
United States of America,
and to the republic
for which it stands, one nation, under God, indivisible, but
Liberty and justice for all.
And so the department is very grateful.
Okay, thank you. I don't know what just happened. Are we all on?
Yes, we're all on.
yes.
Okay.
Yeah, Patty, some people are muted when they're not speaking and it creates some background noise.
Okay. And right now I'm looking on the screen. Oh, here comes the flag. Give a salute, everybody. Now the flag's with us. Okay. Thank you. Okay, so we'll start. As you know, since the beginning of the health crisis, our regularly scheduled March 19th meeting was postponed, and then our April meeting was switched to a virtual, and we're continuing to meet, and we've decided to meet twice a month, or a little bit of a shorter time, 2.5 hours, but to do it twice, considering how it's challenging to be on a screen for many hours, and it's not advised from a health perspective. But I did want to mention that despite the crisis that we are all in, this pandemic, the commissioners and the staff have been continuing to work very diligently and will continue to do so. There's never a more important time for oversight to be front and center is when there are crises, and specifically in a pandemic that we have now, which is both a public health crisis and an economic crisis. So there are a few ground rules for this meeting. I understand we have, I know the number keeps growing of the number of people who are listening, which is very gratifying that we have that much interest from the public. And this is a public meeting. So I want to remind people, just as it was sent out on the agenda, to access the meeting, you have to do it through WebEx. So please use the web link to join the session with your first name, last name, and email. And you could do that on your computer or your smartphone. And when you register, you'll be able to select which agenda items you would like to comment on. Your information will not be shared with other attendees. So another little counsel is when you're going to provide public comment, please be sure to eliminate as much background noise as possible. And depending upon the number of participants, we will have 1 or 2 minutes per person of public comment. And I want to say at the outset, we have over 100 people who would like to have public comment. So to make this at all possible, we're going to have 1 minute per person. So please prepare yourselves right now. I regret that we have to shorten, but with so much engagement, we want to make as many people, give as many people the floor as possible. So there's been a little bit of a change in our agenda. I want to announce that on Tuesday, the COC sent a letter to the sheriff concerning his recent announcement that he intended to close several sheriff stations and curtail the activities of several important units, including those that investigate sexual assaults and sex trafficking. Our letter requested that the sheriff or a senior member of his staff appear today to discuss those proposed cuts. We were informed yesterday that the department is not prepared to discuss the matter today, but they would be meeting with the offices of the Board of Supervisors and the CEO's office to discuss their budget curtailments in an effort to mitigate any budget shortfalls. The gravity of this situation requires immediate action from the commission as such, and due to limited information the commission has received from Sheriff Villanueva, a letter was sent to the CEO, Chief Executive Officer Sachi Hamai. So I just wanted to alert everyone that also, as far as I know, there won't be anybody from the sheriff's department, unless that's changed in the last hour, that we will not have a representative from the sheriff's department with us today at this meeting. And we didn't have one last meeting and the meeting before that. I'd just like to point that out for the record. We are the Sheriff's Civilian Oversight Commission. So I don't mind saying publicly that it's really important that we have representatives of the Sheriff's Department participating in our meetings and in our function. I do want to announce too that if a speaker if you want your name to be placed in the minutes, please indicate that. The way it's going to work is once we get to public comment, I believe it's Ingrid or Jennifer who will be fielding those comments probably through the chat. Okay. So agenda item 1 is the administrative, and what I'd like to do is hold that for a little bit later and move to the discussion on the Sheriff's Department efforts to address COVID-19 issues. No, actually, we don't have it. I don't even think I think we're skipping that. Brian, are we skipping that?
No, we do have speakers available for item number 2A, the discussion about the sheriff's issues in the department.
Okay, and we have right. Yeah. Okay. Good. Okay. I'm sorry. I just lost my way for a minute. So we have 3 speakers who are going to be joining us today. Because we have been putting out feelers and letters to find out what has been going on with issues regarding ICE and any released inmates, and also how it's going in terms of the sheriff's efforts to reduce the jail population. And there are still some concerns about the existing population. So today we're going to have, we don't have Assistant Sheriff Bruce Chase with us, but we do have Judge Peter Espinoza, who's the director of the LA County Office of Diversion and Reentry, and we've had the pleasure of his speaking to us in the past. We'll also have Dr. Jan King, who's the regional health officer from the Department of Public Health. And then we also have the director of Correctional Health Services, Dr. Jacqueline Clark Weissman. What I'd like to do is to have our speakers go in an order, and if you commissioners, if you wouldn't mind, just keeping a note of the questions you have for each one of them, and then we'll come back and open up the floor for the discussion. Does that sound okay with everybody? Take your notes. Thank you, Judge Espinoza, for joining with us. Would you please, you have the floor. Thank you for being here.
Sure. So my name is Peter Espinosa, and I'm a retired judge of the Los Angeles Superior Court. I'm the director of the Office of Diversion and Reentry, which is a division within the Department of Health Services. For those of you who don't know about us, let me just give you 2 minutes on who we are. We were created by the Board of Supervisors in 2015 to directly address the high population of inmates in the county jail who suffer from a serious mental illness. We have instituted a number of court-based interventions. Through those interventions, removed close to 5,000 inmates over the 5-year period, either into community-based restoration programs if they're incompetent to stand trial, or into interim and permanent supportive housing through our felony pretrial program, our state hospital diversion program, our maternal health program, and some of our other interventions. That having been said, when the COVID crisis came on to the scene, we began scaling back our court-based work and focusing our attention on inmates who are coming out of the county jail who could benefit from our services. And our services include housing, clinical services on site. We run a series of residential facilities. They're 20 to 30 beds a site with both clinical services on site, medical services on site are available depending on the acuity of the patient population, and case management services provided by community-based organization. We have been collaborating with the Sheriff's Department, the Los Angeles Superior Court, the DA's office, the Public Defender's office, alternate Public Defender's office, and the ICDA and the private bar to coordinate the release of inmates coming out of the jail. We began attending daily meetings. We came into the coordinated release process somewhat late after the list began being established by the Sheriff's Department and reviewed by the court and the justice partners. But when we did come into the process, we began attending daily meetings with Correctional Health Services, Sheriff's Department, Whole Person Care, ODR, to help refine, amongst other things, from ODR's point of view, to help refine the process whereby inmates are released from the jail to make sure that they could be released into our care and not simply just released into the community. Since we have been working on that, we have had 363 inmates released to us since the beginning of March, directly into our care. Amongst the programs that we operate is our maternal health program. We were directed by the Board of Supervisors a couple of years ago to develop strategies to remove pregnant women from the jail into care. Their care is somewhat different than the care that we provide our acutely mentally ill folks, but it is consistent with our housing and clinical services. Since the maternal health program began, we have removed 147 women from the jail into care. Since the COVID crisis ensued, we have sort of refocused, redoubled our attention on this population. We have removed 13 additional women into care. As of last night, there were 8 women in the jail who were identified as pregnant. We are working on those cases closely with the DA's office, the defense bar, and the court, and the Sheriff's Department to try to get as many of those remaining women out and into our care as possible. Some of them are on their way to state prison, but as you know, the state CDCR is not currently accepting inmates from the county, so we're working on discussing strategies to get those women out since they're not going to be going to state prison anytime soon and placed in our care. Sorry, now I've lost my way somewhat. I just want to say that we've been working very closely with the Inmate Reception Center staff and the staff at the Community Transition Unit to coordinate our releases. As you may know, when an inmate is released to us, the paperwork goes through the Inmate Reception Center and the Community Transition Unit, and the inmate is held in a separate area of the CTU until our provider comes with a van to remove that person to an interim housing site. All of our transportation is COVID compliant, social distancing compliant. All of our staff are properly attired in PPE. PPE is provided to the person that we're transporting from the jail into our housing. All of our housing sites have been trained in care of this population. So far, so good. We continue to work with the Sheriff's Department and the court. One of the things that we were allowed to do, most of the lists that we've been working from were generated by the Sheriff's Department and vetted by the DA's office and the court. We were allowed to prepare our own list. We prepared 2. The first list we prepared had about 225 to 230 names on it. I don't remember the exact number of medically fragile inmates, and it was focused heavily on the HIV population in the jail. That list was provided to the Superior Court, vetted by the justice partners, and we received the names of just less than 50 inmates who've been released to our care. We also submitted a list of, once that list had been vetted and reviewed and we received the names that we could work with, we submitted a larger list of just over 1,600 inmates who really ran the panoply of medical conditions in the jail, people who were disabled and wheelchair bound, people who were receiving dialysis, people who were receiving cancer treatment, people who were diabetic. And that list has been somewhat more difficult. It was not forensically reviewed by our team. Our medical director is a forensic psychiatrist. So we didn't prepare that list with an eye towards who could possibly be released based on their charges and criminal history. It was just a snapshot of people with medical conditions. That list was not provided to the DA's office at the request of the defense bar. So it's not being used in the manner in which the other lists have been used. It's being used by the defense bar, I think, to identify clients that they want to focus on in seeking early release. And we use it, of course, to cross-reference the names on that list with the names on the list that were being provided by the Sheriff's Department to make sure that we don't miss anybody who's about to be released that we want to offer services to. And let me just say one final thing, and then I'll be available for questions. Our staff is embedded inside of the LA County Jail even during this crisis. They are going up to the modules, visiting inmates in their cells, because part of the process is, because none of these services are court ordered, as they have been historically, these are all voluntary, go and we meet with the people in their housing units, introduce ourselves, discuss with them their medical conditions, their clinical conditions, and offer them services. We describe those services to them, the housing and the care that we provide, the transportation we provide. And then they let us know whether or not they want to accept the service. So that's at the beginning stages. That's sort of the point of entry for a coordinated release with the Sheriff's Department. Once we have an agreement with the person in custody, if they want to come out to us, we provide that information to the IRC. Then we work with the IRC and the CTU to get that person released to us in a coordinated fashion. And as I've indicated, since the COVID crisis began, we have successfully done that with 363 inmates, which is a big number for us. The CEO authorized us to stand up 211 new housing sites to respond to the crisis. And so we are about the business of using those beds and other beds that were already in our inventory to care for vulnerable inmates coming out of the jail. I really think that's all that I have.
Thank you so much. Thank you so much, Judge Rosa. I understand that we don't have Dr. Jan King or Dr. Jacqueline Clark-Weissman with us online at this moment. I think we're trying to locate them. But what I'd like to do before we turn it over to commissioners for questions is invite the Max Huntsman, the IG, to give us his latest update on what he has learned.
Hello. I'll talk a little bit about two things separately: getting people out of jail and conditions in the jail. Obviously, they're related, and it's the conditions in the jail that make getting people out of jail so important. I think, as you heard from Judge Espinosa, getting people out of jail is a complex process. His particular piece of it has to do with making sure that people who are leaving the jail are properly taken care of. Although, as you can hear, he's also involved in the process of convincing the justice partners that somebody is appropriate for release if they are, so they can come to a collaborative agreement on that. And that's a skill that he has because his first name is Judge. He used to be a judge, and so he has that special skill, and that's critical in this process. So that's an important part. But the reason we're doing that is we're now up to something like 205 inmates who have been tested positive for COVID, and that is with very limited testing. As we received complaints a couple of complaints yesterday from Kim McGill. One was a continuation of a previous complaint, and another is a new one. And one of the pieces of that is concerns about limited testing. One example of that being the 2300 block, where reportedly people with symptoms as of over the weekend hadn't been tested. We haven't yet verified that. We're attempting to get information from Custody Health Services, having some difficulty in that regard, which I'll discuss in a minute. But ultimately, we will follow up on that. But they're trying to shift to a model where we test more people. So hopefully we find out who really does have it and who doesn't. But at the end of the day, the dorm setting of the jail, which is the dominant housing format for the jail, is brutal for transmission of COVID-19. It's the same problem we have in camps in juvenile, and where the virus has not gotten yet. But since it is now in the jails and is now spreading in the jails, it's very, very difficult to protect people in a dorm setting. And that's why the efforts to remove people that Judge Espinosa was talking about are critical. Along those lines, the 9300 module that I talked about in our last meeting, an LGBTQ module, many people who are HIV positive, Times reported on it at the end of March. And I've been down a couple of times since to monitor it. As I told you last time, as of the last time I checked, there were 100 people in the dorm, and 43 of them, just from my looking at what they were charged with, appeared to be eligible for removal from jail in the sense of being nonviolent people who are at least possibly could come out. Not to say that process that Judge Espinosa talked about wouldn't narrow it down. I'm sure it would, because you always find out that there's complications in some of those cases, and each of those people would need treatment. But that's 43 out of 100. That's 40%. And I have no reason to think that the jail as a whole isn't of a similar breakdown in terms of violence. The Sheriff's Department recently announced publicly that pretty much everybody who they could get out has already left the jails. And their approach seems to suggest that, because for a week, the population has not been reduced much. It was 11,800 some a week ago, and it is today. So it's down, maybe down 5 bodies as a result. But the large scale reduction of population seems to have plateaued a bit. And that may be simply because we're now into the things that Judge Espinosa was talking about, which are more difficult cases that take time to work. There may be other reasons. But all I can say is, in the beginning, we were rapidly reducing our population, or comparatively rapidly, and that seems to have slowed a bit. There is at least one lawsuit pending attempting to change that. So a judge may weigh in at some facts to be collected. But you need to understand that, in fact, in the dorm settings, for instance, in that 9300 block, that's triple bunked, and the bunks are within 3 feet of each other. So the idea that I think has been expressed by the Sheriff's Department, that if we tell people to sleep head to toe, that takes care of the problem, it does not. Because in a triple bunk, somebody's head is lined up with somebody's head, and they're 3 feet apart, and somebody's above somebody, and they're coughing on. So at the end of the day, this is going to transmit the virus if somebody is ill. We do not have effective testing that is rapid and it's covering everybody. We've already had these complaints regarding places where there seems to be a bottleneck of the testing of people who have some symptoms. And this has to do in part with Custody Health Services' definition of what triggers a test, which requires 100+ temperature. And so people who don't have that particular symptom in the past were not getting tested at all. Now I believe they're trying to step that up. We have brought to their attention the concerns that Ms. McGill brought to our attention, as well as numerous other ones we've received. I hope you've seen the complaint that Kim has sent in. If you haven't gotten it, I'm sure she'd be happy to give it to you, and I would as well. Just email me and I'll send it to you because we've gotten her permission to do that. These folks, in some cases, I think, are not rapidly getting tested. In others, they are. We've had problems with Custody Health Services where we went down to check on temperature checks. They're supposed to be checking everybody as they come in, prisoners as well as staff on a daily basis. And initially they were not doing that, and now they say they're doing it, but we found instances where they weren't. Not on purpose, but it just wasn't happening. And so they have installed some quality assurance to try to improve that, at least in the spot areas that we brought up to them. Same problem with soap. That's part of the complaint you get here, the question of disinfecting, how disinfecting can be done. When I last looked at this issue, what I found was yeah, the sheriff's department has a lot of soap and they're distributing it, but there are a lot of places it's not getting to for a variety of reasons. And so it's always a challenge. It's not that people aren't trying, it's that there's a challenge in creating an environment in a jail in which people can actually clean themselves. And then also the environments are clean. So for instance, if a person is sent out of their cell currently for discipline or some other, or isolation or quarantine temporarily, they are generally not cleaning those cells. And the explanation we get is, well, often their property is still there. You could still clean around the property, but it's more difficult. It's not that people are simply not doing things, it's that problems in the implementation of all these measures, which in your own home you would be able to implement, get in the way of successful epidemiological hygiene practices. And so as a result, we have an environment in the jails that is transmitting the virus rapidly, and it's growing at a much higher rate now than it had been before in terms of the numbers of people. So that's the nature of the problem. I just wanted to highlight, we're on an ongoing basis, we're trying to work with custody health services to monitor their conduct. I want to pause for a moment and speak to anybody who's listening who is a deputy sheriff, or who is a prisoner, or is a member of the frontline health staff who are working. I want you to know that we are actively engaged in trying to monitor the conditions and trying to make sure that all the folks within government take your safety concerns seriously. You're not alone. I know it feels that way sometimes for all these people, both those who are locked up and those who are coming into the place that's locked up working. They sometimes feel like the people above them aren't listening or don't care. I want them to know that people are trying and efforts are being made. It doesn't make it all perfect or make it work right, and I can't promise success, but I can promise you that we're not giving up and trying to do something about that. We had some county employees who sent a letter that made its way to the governor complaining about conditions themselves. So it's not just prisoners who are complaining to you that they feel that they're not being protected properly. It's not just the loved ones of those prisoners, but it's county employees as well who see the same types of problems and are concerned about them. And we are attempting to monitor that. We've had difficulties within the government getting the managers to properly address those issues and facilitate our ability to speak to employees directly without fear of them being retaliated against, essentially whistleblowers. There's lawsuits now pending, which makes everybody more squirrely. There's good about lawsuits in that judges can step in and craft remedies, but there's bad too. In the same way that coronavirus locks down a lot of people's responses to try to take care of the problem, lawsuits can do that as well. But we're working it actively. We're trying to make all this work out and make sure that the folks who want to get to a good solution carry the day, and we can follow up on all those complaints. So I expect I'll be going up to Castaic shortly. Kim has brought up a problem up there that we'll look at, and the 2300 block in downtown where we've seen a lot of problems. We've are also monitoring closely, and I can't say that all the complaints in that you get are, I can't verify them all, but I can tell you a lot of them dovetail with things that we've observed. The problem with temperature checking, obviously, masks is a big problem. Initially, there were no masks for prisoners. Now prisoners are getting masks, but they have to reuse masks. And as we discussed, cleaning is kind of hit and miss. And prisoners, I think, also have a resistance to wearing the masks. It feels frustrating, and they're in their home essentially, or what's being forced to be their home. And so they don't always want to wear them. So when I went and talked to the 9300 dorm, there were lots of people there not wearing their masks. And when a person doesn't wear their mask, they're risking the people around them. So it's not a choice you make to protect yourself. It's a choice you make to protect others. And if you got 100 people in a dorm, somebody's not going to do it. So it's a built-in problem. Access to video conferences, we've gotten complaints from attorneys regarding that, and have looked into it and are trying to get the department together with the providers to improve access to video conferencing. We discussed the cleaning supplies and the disinfecting of cells issue. We have, whenever we've gone down to the jails, we've talked directly to the department, and they've always been responsive on a case-by-case basis. I think they're trying to provide those materials, but having mixed success. In some places it works great, very smooth process. In other places, such as, I think I talked about this before, disciplinary cells, which are much like high observation housing for the mentally ill, except that a person is sort of temporarily mentally ill because they had a violent incident. They're angry, the department's scared of them or angry at them, And as a result, cleaning doesn't work as well. So these are the challenges built into our jail, and that's why I encourage you
Max?
all. Yes, ma'am.
I want to, I just want to let everyone know that we do have Dr. Jacqueline Clark
Oh,
Weissman.
wonderful. So
Joining
perhaps we can hear from her.
I'd like to, I've just finished, will you just draw your final conclusion, your final comment?
No, that's my final comment. It's just that I call on you all to continue to advocate for an effort to remove people when appropriate, and also for us to improve the conditions of COVID safety in the jails as best we can. So thanks.
Okay, great. Thank you so much. Okay, so we're, I'm so glad that we have the Director of Correctional Health Services with us, Dr. Jacqueline Clark Weissman. And I believe the commissioners, you won't be able to see her photo, but she is on the phone. Dr. Clark Weissman?
Can you hear me?
Yes.
Okay, I'm so sorry I wasn't able to get on where you can see me, but again, thank you so much for inviting me to the commission today. And I will just try to provide a, an oversight of sort of what we've been doing to, number one, to prepare for COVID-19 and to some of the actions and steps that we have taken and currently are taking, and that's evolving every day. I don't know if I was provided a list of questions, 14 questions, and I am able to respond to those if you would like, or would you just like an overview and then respond to the specific questions?
Yeah, I think that would be preferable. Just give us a brief overview and then delve deeper. Thank you.
Okay. Well, again, just like everyone else, we knew that COVID-19 was going to be coming to LA. It was not a matter of if, but it was a matter of when. And so back in early February, I started working with the Sheriff's Department and other partners here in LA to try to prepare us for dealing with this in the jails. So working with Assistant Sheriff Chase and his staff, we reached out to the other law enforcement agencies to see if they would alter their pre-screening arrest form to use multiple questions to pre-screen. For example, we were using what everyone else was using. Do you have flu-like symptoms? Do you have a fever? Have you traveled to the different countries at that time that was really seeing outbreaks of COVID-19? So I got very good cooperation with that. They changed their form. They were asking those questions. We worked with them to provide, if the patient says yes to any of the 4 questions, that they would be provided, the patient would be provided a surgical mask, and then we would have the custody staff, if it's a deputy or LAPD or a highway patrol, to don some type of protection themselves, either a N95 or a surgical mask. And we worked with Kathy Chittister, she's over EMS and emergency response for the county, to work with her to provide the different law enforcement agencies appropriate PPEs. So that we started that back in early February. Then we set up in early March systems where when these patients were identified as saying yes to any of those questions, we instructed them not to bring them into the facility, to have those patients stay in the Sally Port areas where the cars are. We also eventually got tents in the 2 areas, the main jail, IRC downtown for the men, and CRDF for the women. They have tents where these patients now can be bought into. Our healthcare staff then go out to the facilities in the 2 tents, and they do an assessment. Number one, they confirm that yes, the people did have positive responses to the pre-arrestee forms, either fever, travel, or whatever, we ask additional 33 questions to get more information on the patient's condition. We then take a set of vital signs, which include a temperature. At that time, we were using the barometer of 100.4. If you had a temperature of 100.4, we would then move you directly into the CTC, and the patient would be placed on isolation for a period of 14 days. That same day, we would take a swab of that patient for COVID-19, and then that person would stay on isolation until we receive the results back. If the results came back negative, that patient was released from isolation. If the results came back positive, that patient would continue to stay there, and we would just do appropriate treatment based on the symptoms. So that was part of sort of early March. As things are changing with COVID-19, we were first just using the temperature of 104. There's been recommendations out from CDC. You have the cough, you have body ache, fatigue, metallic sort of taste in your mouth. You lose the sense of taste and sometimes smell. We have sort of added that to the medical screening, not the pre-arrestee screening. So we are receiving patients from both sides, both the custody pre-screening and then our normal medical screening that we do on every single inmate coming into the jail, which does include a set of vital signs, and these additional questions are asked. And also, because we are a jail and communicable diseases historically is something that can spread when there is congregant living, our normal intake process is designed to try to find these types of diseases. Typically we're concerned about TB because it's airborne and things like that. So our questions really are designed to elicit answer to get us to identify people quickly, get them in the appropriate housing quickly, and also provide care. So I'll just give you, so that's just sort of the background, and we have been managing the first 2 or 3 weeks. We had 0 cases. We started a daily meeting that includes the Sheriff's Department, myself, public health, an infectious disease doctor assigned through Harbor to work with us full time on managing COVID-19 and trying to limit the spread. I think I drafted a document, basically sort of a overview of, what we have done, what our plans were. I think that was put out in April 13th. And we have, we're updating that every day as things change. So just recently, I'll just give you our, current numbers as of today. I think Mr. Huntsman did mention some of the areas that were and are on quarantine, but I will give you the current numbers, and I think those were some of the questions that were asked in the pre-questions that were provided to me. As of this morning, we have a population of 11,837 inmates. We currently have 170 inmates that are positive for COVID-19. Of those 170, we have 5 that are at LAUSC getting provided a higher level of care for a total population of 175 of positive inmates in the LA County jails. and that's all of the jails combined. We have also what we call a PUI. A PUI is a person who exhibits symptoms of COVID-19. And again, that could be a cough, a fever, a complaint that I, feel body aches or fatigue. We have a low threshold now for who we will consider a PUI. Those patients are pulled out from whatever housing area they come from, and they are placed in isolation, and then a COVID-19 test is provided on that person, and the housing unit where that person came from is then placed on quarantine for a period of 14 days or until we receive a negative result back from the PUI. If we receive a positive result back from the PUI, that dorm stays or housing unit stays on quarantine, and then healthcare staff then does surveillance on the quarantined area, which includes nurses making rounds twice a day, taking temperatures on the inmate population. Sometimes, data now is showing that just a temperature is not the only factor for early COVID signs, because what they're showing now is you may not get a fever for 4 or 5 days post-exposure. So some of your early symptoms could be the cough, could be the sneezing. It's, compounded also now because you have just normal allergy season. But again, the threshold for us is very low for that. And we, if an inmate says they have cold, cough, sneezing, or whatever, we're considering that person a PUI. We're testing that person and placing that area on quarantine. And that's one of the reasons why.
Dr. Clark, we just found out that Dr. Jan King is also going to join us. So I wanted to ask.
Perfect.
But do you have, just a quick question, if I might, how many deaths have there been?
We have not had an inmate death since we have started, or not started, but since COVID-19 entered the jail. I did just mention we do have 5 individuals that are in the acute care hospital. None of them are on vents at the time, a ventilator needing, supportive breathing. We do have a low threshold for who we will keep in the jail. We have sent out directives to the providers, letting them know if we can't manage the patient's fever, if we can't keep them hydrated, things like that, our threshold is lower than what the community threshold is for sending someone to an acute care hospital.
Okay,
go ahead and run real quick so I can just finish the numbers. We have 3,785 inmates currently today that's being quarantined. That in quarantine means that their movement is stopped. They stay in the location where they are. They're seen by nursing twice a day. Temperatures are taken twice a day for those patients, and the reason we do that is to try to identify people that may not, otherwise know that they are not feeling well or sick. We have 65 recovered COVID people. Those are people that were positive and have been symptom-free, not needing any type of medication, and for at least 10 days, and that's using CDC guidelines. So I think that, the big issue with what we have done or our current state of COVID-19, either PUIs, positive, quarantines, and recovered. The other thing that just started in, I think it was last Friday, we started doing testing of all new arrestees. That started on Friday at CRDF, and then, which is the female facility, and then we started it over the weekend at our main intake IRC downtown. Again, that was started last week. We are using the conventional test with the nasal swab. That's going out to Quest Lab. We are still working with DHS to try to obtain rapid testing for me. That was one of the reasons that I did not start testing sooner than May 1st, because we have been trying to get rapid testing, just the number of inmates that come into the jail and our ability to test and then isolate them for a period of time until we get results back. The only true effective way for me to really do this is through rapid testing. Rapid testing has been a product that is very hard to get across the country, but I do have Dr. Clemens and folks from Dr. Galley's office trying to work on getting us that. There's 2 separate types of machines we're trying to get. One of them is the Abbott machine, and the other one is ID Now. ID Now is the machine that would really be beneficial to us, as it is able to test a large number.
Dr. Clark, how can we help get that for you? A lot of people are listening. A lot of people are listening to this meeting right now.
I don't know. I think it's just supply and demand. The company is in Sunnyvale, California, in Northern California. It's a small company that's producing these machines, and then there's also cartridges that go with the machines to run the test. The reason why that machine would truly be the best for us is the number of tests that can be ran within a short period of time and receive results back in less than 3 hours. So they're actively working.
This sounds like something that the public needs to know more about. But thank you so much. I'd like you to just hold on while we, if that's okay with you. I'd really like to bring Dr.
Yes.
Jen King into the conversation, and she's here with us now, and she's the director of the health officer, the regional health officer from the Department of Public Health. Dr. King, you're on the line. I don't think we can see you, but please, you have the floor.
Oh, good morning. Thank you for inviting me to speak a little bit about our response to COVID. We are definitely in a better place than we were previously. So currently our numbers are decreasing and flattening. For our week-to-week numbers regarding COVID deaths has been slightly decreasing. We have additional knowledge just about how the virus works itself. And our leaders are currently planning for a relaxing of our health officer orders. So we're definitely in a better place as we move forward. Many of the things that we're working on right now have to do with standing up more expansive testing, as you know, especially in skilled nursing facilities, which is this one area that we still are seeing a lot of deaths. As you know, people who are disproportionately impacted are skilled nursing patients, people with chronic, persistent chronic diseases, but also the elderly. So we're standing up, being able to test people who are symptomatic, but also non-symptomatic, and organizing around that. We're still addressing issues of disparities that we're seeing. So 2 areas that have been highlighted in this COVID response have to do with socioeconomic disparities as well as by race. So the first disparities that we saw were related to economics. So as we were providing information regarding rates of COVID 2 months ago, what we started noticing is that certain groups, certain areas, high income areas such as Hancock Park, Beverly Crest, had higher rates of disease. But then we were wondering, why is it that these certain groups have higher rates? And then we realized that our theory is that there was more testing in these areas because of access to care, but also they had underlying reasons that were the criteria for testing. So there was more travel to China as well as to Europe. But as we've moved forward, we realize, and the data supports the fact that as income goes down, so does the rate of testing. And this is a challenge because what we're seeing also is that a higher proportion of individuals who are dying or COVID has to do with income. So the higher the poverty rate, the higher the death rate we're seeing from these particular groups. So we're seeing that, and we are taking efforts and creating measures so that we can increase testing as well as this awareness of this within low-income areas as well as in the Black and Brown area, populations. So African Americans still have high rates of deaths from COVID, which is higher than the proportion of the population. Initially, you would look at the Latin population and think that they're being spared because the population of Latinos is about 47%, whereas people dying, Latinos make up 37%. But if you look closer at the data, you're seeing that young Latinos, the Latinx population, is disproportionately impacted. So we are trying to get the word out. We're trying to get additional testing in certain areas where there's lower income, where there are people of color, but also getting culturally relevant information out to the public so that people are aware that they might be at higher risk. All these issues are really important as we move forward, and that our safer at home orders are being relaxed in the hopefully the next couple of weeks. So I'm going to stop there and see if there's any questions or anything in particular you want additional information on.
Okay, thank you so much. Thank all of you for joining us today. Yeah, your certain points have been highlighted, and I'm sure the commissioners have questions. So let's turn to that. And if you wave, I'll be able to call upon you. And I see Lal, and then I see Patrice, and then I see Priscilla. I'm sorry, and then I see Sean. Was your hand up? Commissioner Kennedy? No. Okay. Commissioner Rubin.
Yes, thank you for each of the three speakers. As many of you know, several of us have been involved in an ad hoc committee to try and understand these issues. And Dr. Weissman, if I could just start with you, Park Weissman, one of the things that there has been some confusion on in our minds is who makes the determination in the jail that inmates need to be moved. We have had information that Correctional Health Services is the one who tells the sheriff, like has been described on, Housing Unit 9300, that inmates should be moved. The sheriff has said that he can't make that decision himself. He has to rely on you and Department of Health Services. So if you could answer that question, I'm sure there'll be others as well, but I would appreciate that.
Okay, and can I just also just say that I am not a doctor. I am the director of the correctional health. I am a nurse by license and trade. I have a master's degree in nursing, but I'm not a doctor. So I wanted to at least, put that out there. But no, I will absolutely answer that question. So, from the very beginning, early March, when we started this process, as soon as a patient is identified as either a PUI, they're exhibiting some symptoms associated with COVID-19, that patient is put on isolation. We cannot do that without the Sheriff's Department. So it's a medical correctional health staff in the jail, we're making that determination, basically saying this patient meets our criteria and they need to be moved to a identified place for isolation, and we have those pre-identified in the jail. So the recommendation is, custody's informed, and those patients are then moved. In the same vein, once those tests come back and the patient is quote unquote positive, the dorm that they came from is placed on isolation. As soon as they become a PUI, that area is placed on quarantine. And again, that's a joint effort. We talk to the Sheriff's Department. We meet 7 days a week, even on Saturday and Sunday, talking about the PUIs, the positives, the quarantines. We have coordinated also with the courts, because even though, we are trying to limit movement within the jails and not have people move around and just do a lot of housing moves, we still have 300 to 400 people a day still going to court. So we have worked with both Judge Oda and the judges to see how we can work together to sort of limit that. I know that they're trying to increase video arraignment, but we also saying if they have to go to court, can they go in, buses that are not really populated? They're wearing a mask. Now they all have masks, and if they're coming out of a quarantine dorm, we're working with the law enforcement and the justice partners to see, can those, that court date be delayed, or if there is another mechanism, because again, we're not wanting to have people pulled from a quarantine area, moved, and then exposing, a larger community. So again, to answer your question, the determination to put someone on isolation, quarantine is a healthcare decision, but we have to have the Sheriff's Department cooperation and support, because they're the ones who manage and move the inmates.
Okay, if I could just ask one follow-up question in that regard. Thank you for that. But again, if we could go specifically to the concern about the housing unit in 9300 that Max Huntsman has talked about. The decision to create some other way of housing the inmates in that section, is it a healthcare decision, or is it a sheriff's decision?
That's a sheriff's decision. I can only manage and take care of the inmates that are in the jail, how they're housed and their sleeping arrangements. It's not up to me. It's not up to healthcare. We can recommend what we believe are quote unquote best practice, what other people are doing across the country, but that's a question I think that should be directed to the Sheriff's Department, because I don't control or have really influence on the housing situation.
Thank you. That's helpful.
I want us to get to public comment as soon as possible, but I want to turn over to Commissioner Ocean before that. And if there are other compelling questions from the commissioners, maybe we could come back, because we have a lot of public comment. We're going to hear some, I believe we'll hear some authentic voices on the topic. And I see Commissioner Harris has a question. But go ahead, Commissioner Ocean, please.
Thank you. I have a lot of questions. I'll try to keep them to a minimum. But first, I just want to say I think it's outrageous that the sheriff isn't here to answer questions about what's going on in the jails. As we have roughly 25% of the total population, either having tested positive or in quarantine or isolation. That's I think it's unconscionable if the sheriff isn't here to answer questions about how they're structuring, for example, housing. And from what we've heard, people are being housed in such a way that is increasing their vulnerability to COVID-19. And I think I think it's outrageous. So, but separate from that, I have a question about, for example, what does quarantine and isolation actually look like? I think from CHS, this is directed to CHS. Can you talk a little bit about what that means? So you're using those terms that sometimes are used in terms of just basic housing based on security, and now we're using them in a public health context. I'm wondering if you could describe how people are treated while in isolation or in quarantine.
So for us, isolation with regards to COVID-19, when you are placed in isolation, you're placed in a area that's totally by yourself. You're not allowed to move or interact with other inmates or peers. We, healthcare, see you every day, assessing symptoms and any type of increase in symptoms, coughing, fever, or stuff like that. We're waiting for a test to come back, or you can already have a test result back and be positive. That person remains in isolation until they no longer have any symptoms. And so it's a minimum of 13 days. They have to be symptom-free for a minimum of 3 days without having any, say, Tylenol to reduce a fever or something like that. No cough, and we're not using any cough suppressants. So that's where that person is just by themselves in isolation. Quarantine is a larger group. It's usually a housing unit, and that could be a housing unit that has individual cells in that unit or a dormitory setting. And what we're saying is quarantine that someone has either been a PUI that came from that area, or is a positive that came from that area, and now you have been exposed to someone who is exhibiting COVID-19 symptoms, and so we are quarantining you because we don't know how many of you have been exposed, and then that's why the surveillance, hence the nursing staff are making rounds, doing temperatures twice a day on the quarantine unit. They will stay on quarantine for a total of 14 days or until the result comes back negative. If the result comes back negative, they can be released off of quarantine. If the result came back positive, that housing unit will remain on quarantine for that 14 days.
And there are a number of I think the highest number of individuals who are in quarantine is at NCCF. I'm wondering if you all have any specific strategies for dealing with what seems to be a potential outbreak that's much larger than some of the other facilities at NCCF. Are there any specific strategies there?
Yes, we have talked with Department of Public Health, our infectious disease, Dr. Lauren Miller, on sort of the best ways to deal with them. That group is a group that most of their housing is dormitory, and we believe, I think the cases probably started from them coming back and forth to court, because we did not see any cases come out of NCCF until about 2.5 weeks maybe ago. That's when we first had our first case up there. And that's what we see when we're looking at modeling in those types of settings. Once you have one person, and I think the data is showing that the one then can expose 3, and then the 3 can expose 9. And I think that's where the dormitory sort of setting is the most at-risk sort of population. We have a high number of positives. The majority of our positives are right now coming out of there. I thought at one point to just consider NCCF a whole quarantined facility, and then just, do heightened surveillance and possible testing for those people, or just consider all of them have it. We are looking at trying to do antibody tests, trying to get a test that we can see who actually have, been exposed to COVID, but then are not seeing any, having any symptoms. I have requested tests to try to start testing asymptomatic patients that are not, coming from the outside. Right now, all new inmates coming in are getting tests or offered tests because they do have the right to refuse. The one good thing is, the largest number I think we had was like 200, but only 6 refused that day. And when we asked, the reasons why they're refusing, people had previous nose trauma or just have, some hesitance of having the swab, specimen taken up their nose. So we're also trying to get an option of an oral one. I am devising a plan that we are targeting some of our high-risk patients. Our very first COVID-19 positive patient was one of our mentally ill patients. I think that what ODR has done, I think what the Sheriff's Department has done in reducing the number of inmates, because again, when we started this, it was over 17,000. Now we're below 12. But we still have a large number of mentally ill patients remaining in the jail. They've released over 5,000 patients. We still have over 5,000 mentally ill patients in the jail. And I have a large HOH population, which is more of our seriously mentally ill, and they represent somewhere between 700 to 800 of what I consider some of our still medical vulnerable patients. And that's a group that we're trying to work with our mental health, my mental health staff, and having them over, they started yesterday, over the next, few days, letting their patients know that we are planning and we will be coming to their cells to collect tests for the COVID-19. We have multiple populations of vulnerable inmates or inmates that I would like to, test that are asymptomatic. They're in areas now that we, the CTC has about, yes.
Dr. Clark, this testing obviously is critically important. So I want to hold that, because that, I don't know where the accountability is to get testing in the jails. So we have to talk about that. Commissioner Olson, you do have a follow-up question?
I have a lot of other questions, but I know that we want to get to public comment. I just have a comment, which is that I appreciate that CHS is moving toward testing asymptomatic people, because we know that roughly 50% of COVID-19 carriers are asymptomatic. So a testing regime that rests solely on people who have symptoms is not really going to be effective, and will only perpetuate the spread of COVID-19 in the jails, because as I think all of the medical and public health professionals have said, the jail is not structured in a way to keep, in such a way to keep people healthy. And that's true in normal times, and it's especially true right now. So I think our focus shouldn't just be on testing, it should be drastically reducing the number of people in the facilities. And I've asked during our ad hoc committee meetings, what is the ideal number of people in the facilities to permit social distancing, universal testing, and comprehensive wellness checks? And I haven't been able to get that number. And I think public health, CHS, the Sheriff's Department, and the OIG need to be working together to figure out what that looks like so that we can keep people safe during these unprecedented times.
Okay, thank you, Commissioner Ocean. I want to turn quickly to Commissioner Harris for your question, and then I really want to move to public comment.
Yeah, thank you. And quickly, Director Weissman, my question is around 9,300. Is there anything you think the Sheriff's Department could do that is not being done to resolve the ongoing issue in 9,300?
You know what? I honestly don't. I don't know what steps they have taken or should take. I know that that was a group that they have reduced populations at some number. I don't know the exact number, but that's something that I believe the Sheriff's Department would need to answer.
And Commissioner, if I could jump in there, Max Huntsman, it hasn't been reduced, or at least it hadn't been the last time I went. They have released people from that dorm, but they have then filled it back up with other people from other places in the jail. So it has remained full, triple bunked within 3 feet. The state has issued guidelines for institutions saying you cannot do that. You have to be 6 feet apart. You cannot house people in that kind of sleeping environment. That environment is in violation of state guidelines, and the people in it should be released if they cannot be housed in a different manner. As Commissioner Ochen has said, we need to get down to the number that is actually safe. It's not just a fixed number, though. It's how do you house them? If we keep 100 people in the jail, but we put them all in a dorm right next to each other, that's no good. We need to house people in accordance with state guidelines, which we are not doing. We need to do asymptomatic testing, which is the state guidelines for congregate living, which we are not doing. We need to do these things. Otherwise, we are putting people at risk. And the question was asked about deaths. There have been no prisoner deaths yet, but there was a CHS employee who passed away. So it's this, the fatalities are still out there, and we don't know how much these numbers will grow. And currently, the living environment in 9,300 is in violation of state guidance, and the sheriff has the authority to release those people or to house them separately if he wanted to, and could do it tomorrow. But as Priscilla Ochen had said, he's not here, so we cannot discuss that.
Right. So, yes, the accountability question, who's in charge? And I have a question about, it's a little rhetorical. It's not necessary to our speakers, who I really appreciate all three of you being here today with us. And I appreciated your outlines of all the things that you are doing. But the big questions are not being done. The big, the big questions aren't being answered. And the sheriff is not here for the third of our meetings in a row. So we get the impression that the sheriff doesn't want to play in our sandbox. And we are a group that's supposed to provide oversight and ask questions about accountability. At the last meeting, we talked about how the fact that you have congregant living under these circumstances it's a petri dish. It's a petri dish. That's what it is. And as much as people are trying to do things to mitigate and take temperature and do those things, it's still a very volatile situation. And I don't know what our recourse is. Again, it's a rhetorical question. What is our recourse as a commission, as an oversight commission? I know that we hear from the public health department practically every day. We hear from the mayor of Los Angeles every day. We do hear from chair of the board of supervisors about all of this. And I don't know how this population, now down to 11,000, is being treated within that whole county, the whole county zeitgeist, in a sense. Do all these department heads talk to one another? Does the sheriff hear from the Department of Public Health, which is supposed to take in everybody's health, which I would think also includes people who are incarcerated in the whole jail system? They may not have direct authority, but it seems to me the Department of Public Health might have something to say about what's going on and how these actions are, seems actions were started and now it's stopped. So I see the frustration on all the commissioners' faces, and I know you all have a lot of questions, but I think it's important to now, we have 18 people who want to make public comment. We're going to skip our 15-minute break. I am concerned that we have another very important topic to discuss today. But this is certainly of the moment, and I want to switch to public comment.
Can I make a statement? Hi, this is Dr. King. I just wanted to state that yes, we are in direct communication and working closely with the jail system to ensure that the community health of those working and residing in the jail are taken into consideration. So we will continue to provide recommendations and work closely.
Yeah, we appreciate that. We appreciate it. We know you're doing that. But the sheriff isn't here to report on what they're doing from their end. And that was my point. So let's move to public comment, and we're going to have 1 minute per person. And I'm really asking you folks to, when you ask your questions, you'll be called upon by staff to please be disciplined so that everybody gets a chance. Thank you so much.
Okay, Patty, and before we start public comment, how much are we timing folks for?
1 minute.
Okay, excellent. And our first speaker is Audrey George. Audrey, you should be unmuted now. If you could please go ahead with your public comment.
Yes. I didn't even realize I had raised my hand, but I'm very happy to comment because it is extraordinary that the sheriff. She's hear me?
Yes, Audrey, please continue.
That the sheriff has not deemed it necessary to participate in this. I know you have subpoena power, and I'm hoping that you use it very aggressively to obtain information that he could be providing in this meeting. I'm hoping that.
Seconds remaining.
I'm sorry?
You have 15 seconds remaining.
And I also want to have you issue a recommendation that the Civil Brand Commission be able to inspect each jail facility based on recent reporting that the conditions inside those jails remain unsanitary and inhumane.
Okay, thank you for your comment, Audrey. And we are just looking for the next speaker. It looks like an Andrew Lewis is not on. Apologize for the delay. It looks like we have a couple of folks who have registered but are no longer on the meeting. So we're just going through the list right now. Okay, next up we have Michelle Murillo. Michelle, you should be unmuted now. Please go ahead with your comment.
Thank you. So I have a concern. I know that we're doing the testing within the jails, but the ones being released, are they also being tested at some point? You know, whether they have symptoms, they're symptomatic, they're being brought out into the community. Are they also being tested?
Should I, do you want me to answer that?
If you can answer really quick, you know, yes or no.
Just real quick, if they're going into a congregate living situation or a program, yes, they're tested before they are released. Anyone that's in quarantine or isolation or coordinated release is being done with public health for follow-up.
But what about the ones being released just to the public? Are they being, is everybody being tested, or is it just the ones going into some kind of housing?
No, we're not testing everyone upon release from jail. We're not doing that at this point.
Are they going to?
No,
And it looks like the time is up for this portion of public comment. So thank you for that, Michelle. We'll go ahead and move on to the next person. Again, it'll take just a second as we continue to go through the list to see if the folks who registered are on. And it looks like Joseph Maslich. You should be unmuted now. Please go ahead with your comment. You have 1 minute.
Sure, Joe Maslich, and I'm on the LA Regional Reentry Partnership Steering Committee. And I just wanted for us to take a short breath now and to note that the developments over the last few years, and we've heard from many of the people this morning who are involved in them, the Inspector General, the establishment of this commission and Office of Diversion and Reentry, had it not been for these developments and for the community energy that went into getting supervisors to decide to establish them, and the recent ballot initiative, we would be so far behind. These efforts, what you've done, what everybody was doing, they weren't imagining this pandemic, but it has saved a lot of lives. And I want us to feel that satisfaction, and for that satisfaction, energize us in going farther. Thank you.
Okay, thank you for that comment. As we queue up the next person here.
Jennifer, can you queue up people, 2 or 3 people in a row? Is that possible?
Unfortunately, that's not possible because several of the people who registered are not on the call, so I'm searching for them ahead of time. Next up will be Tim Cornegay. Tim, you should be unmuted now. Please go ahead with your comment.
Okay, my name is Tim Cornegay. I am an organizer with faith-based organization LA Voice. And in light of this COVID-19 epidemic, it is obvious that we have to look out and be mindful of the care of our folks who are held in these institutions. And I just want to encourage the commission to take courageous steps and to exercise this like newfold subpoena power when and if necessary, and to ask themselves, what is the sheriff thinking when he doesn't feel compelled to show up at meetings like this at a time when it's so important?
Okay, thank you for that public comment. Next up, we have Regi Bunch. Regi, you should be unmuted now if you could go ahead with your comment.
Thank you so much. I have a quick question. I'm curious about the total liability costs that COVID-19 will have for the jails, and what the COC is doing to mitigate that cost for the taxpayer. If anybody can give us some type of ballpark figure, because one lawsuit doesn't mean that there won't be more. And so I really want to measure COVID-19, let's measure the financial costs as well. Thank you.
Thank you for that comment as we look for the next folks who are on. Okay, Larry Foy. Larry, you should be unmuted. Please go ahead with your comment.
Good morning. I'm with the Interfaith Movement for Human Integrity and Justice, Not Jails. We're on to encourage you to recommend to the Sheriff's Department to continue efforts to decarcerate due to COVID-19. And we also encourage you to recommend to the Sheriff to implement the Constitution mandated procedures to protect people who are incarcerated from contracting COVID-19. We heard that there were over 170 people who already contracted coronavirus. We pray and encourage you to recommend to the sheriff that whatever measures are taken, that they are humane and that they are not punitive in nature, such as quarantining. That quarantining should not be on the order of solitary confinement. We hope that these measures taken will protect lives.
10 seconds remaining.
And that they will honor the sanctity of life and that a jail sentence should not become a death sentence. Thank you.
Thank you for that comment. Next, we have Pastor Byron Smith. You should be unmuted. Please go ahead with your comment.
Yes, can you hear me?
Yes.
Can you
Pastor Byron, please go ahead with your comment. We could hear you.
question? My question is, what is being done or put in place to make sure that the Department of Correction will follow through with meeting the state guidelines as it pertains to housing and accountability as far as testing? I know that we spoke about the DOC being out of compliance. And I just want to know what will be done to make sure that we follow up with the process to make sure that things are moving forward towards the betterment of those that are incarcerated.
Okay, thank you for that public comment. And next we have Gina Viola. Gina, you should be unmuted. Please go ahead with your question. Gina, you should be unmuted. Please go ahead with your public comment. Unfortunately, Gina, it seems that we cannot hear you. Gina, can you try one more time? Go ahead with your public comment.
Sure. Can you hear me?
Yes, we hear you now. Please go ahead.
Thank you so much. Limited testing. I'm very confused by this. The Board of
Can you talk a little louder, Gina? It seems that we might have a bad connection.
Okay, I'm sorry. Is this better?
Yes, it's much better. Please go ahead.
Great. So limited testing, I'm very worried about that. The mayor and the Board of Supervisors have all said repeated times for many days now that everyone in LA County can be tested. So this should be done immediately in the jail situation for everyone. And if it's not being done, then you need to release folks so that they can go and get tested. Max capacity for the jails is somewhere around 12 to 13,000. Which means the number you've released has barely gotten you down to the max capacity. So you need to be letting more people out, especially those 5,000 mentally ill that I heard mentioned earlier. Those need to be released at once. Super concerned about 300 to 400 people going to court during this pandemic. That's unconscionable, and I don't know how you would be transporting those folks in any safe capacity. So that needs to stop right away. I don't understand why the sheriff is not here for this meeting. And I understand your use of the term sandbox, but we're talking about people's lives. So I hardly think that this is a sandbox. This should be a requirement for the sheriff to be here. It's outrageous that he's not here.
Thank you for that comment. Next up, we have Frank Stoltz. Frank, you should be unmuted. Please go ahead with your comment.
I'm actually a news reporter. I have no comment. Thank you.
Okay, thank you. We'll be moving on to the next person now. Okay, Carlos Leon, you should be unmuted. Please go ahead with your comment. Carlos Leon, you're unmuted.
Right.
Please provide your public comment.
One company, this being DC, they can basically help you.
Okay. It's like that SBA, remember in the last downturn when we
I'm
went?
going to go ahead and mute you now. It seems like you are not making public comment. Carlos Leon?
Hang on, I keep worried.
Yeah.
Did everything just go silent?
Yes, we are looking for the next public comment. Paula Ramirez, it appears that I'm not able to unmute you. Perhaps you don't have a speaker. We'll be going to the next person now. Okay, and it looks like that concludes our public comment for this item. Thank you.
Okay, thank you. Thank you, everyone who waited online, and thank you, Jennifer, for fielding that. So, are there any other comments or questions? Before we do that, I do want to thank Judge Espinoza and Director Clark Weissman and Mr. Jan King for participating today. So I see a hand.
Yes, hi. I want to ask, I don't know if we have county council with us, but I think given the many questions that we have for the sheriff's department that are literally a matter of life and death, that we should, if they are unwilling to voluntarily come to speak to the commission, that we should subpoena the testimony of relevant staff, departments in the sheriff's department that are tasked with the sheriff's COVID-19 response, because we need to get the questions answered, and the public has a right to know what the sheriff's department is doing in the various facilities.
This is Craig Hetcher, County Counsel. I mean, that is certainly an option that the commission has. And my understanding, and I am filling in for Lauren Black, is that the Inspector General and the Sheriff's Department and possibly Brian, the Executive Director, are still working out the subpoena process. Brian, you maybe have an update, but that is certainly within your powers.
Sure. We actually met last week, and we'll meet again shortly on the process by which we will go through to subpoena either persons or documents from the Sheriff's Department. Something we're working on, and I suspect we'll have an answer on that within the upcoming week.
I appreciate that you all are still working that out, but a week can go by and we can have double or triple the cases in the facilities and double or triple the number of people in quarantine and isolation. So we frankly don't have a week to wait. So in the meantime, what I would like to do is to make a motion to subpoena the relevant staff and to subpoena relevant data to the sheriff's COVID-19 response, and to task our staff with figuring out exactly how to do that if we don't have a process that's been outlined. So I think if it's permissible, I'd like to make that motion to authorize our staff to subpoena the sheriff for relevant testimony, policies, and data related to their COVID-19 response.
And Professor Chen, we are prepared to do that. We've had conversations within County Council and with staff, and we can make it happen as soon as you give the direction.
I second that motion.
Okay, I do want to make a comment. From what I understand the regulation, it has to be a unanimous decision by every commissioner. It's not, that's what I understand in some of the meetings that is that not correct?
No, it's just a majority of the commissioners.
Just majority. Okay, good. Thank you for that clarification. Thank you. Okay, so we have a motion and we have a second. Any other comment?
Clarification, could we have the name of the person who seconded the motion?
I think Hernan seconded the motion, and I think Commissioner Bonner has a comment.
Yeah, Commissioner Bonner.
Yeah, I would just point out that if we're going to subpoena one or more people from the Sheriff's Department, that would be persons most knowledgeable to testify before the commission, that has to happen, it seems to me, conceptually at our next meeting. I mean, we can't just subpoena somebody to nothing. They have to be subpoenaed to appear somewhere. And so I think that has to be our next meeting, which fortunately is only about 2 weeks away. But we could certainly subpoena data and presumably, perhaps by separate subpoena the data request, work that out and so forth, what documents and records of the Sheriff's Department we want to see. But if we're subpoenaing a person, even if it's a person most knowledgeable or persons most knowledgeable, I don't know how you can actually have them give information to the commission without having it a date certain of a hearing for the commission. So that's either our next meeting or we would have to schedule an emergency meeting of the COC. And by the way, that's a possibility as well. But I just, that would be my comment. Also, this seems very open-ended to me, the way the motion is phrased in terms of, we haven't really defined what data or records we're trying to seek here. We haven't really defined any particular persons, which could include the sheriff. So I don't know, the motion seems a little bit vague to me, but I'm not saying we shouldn't go ahead and vote on it, but I just, I'm a little bit concerned with the vagueness here. Rather than having staff actually present this to us, perhaps with the IG's input as to exactly what it is we're issuing a subpoena for. And one last comment I'll make, and that is, I realize Commissioner Ocean would like to get things moving, and I understand that. I understand the urgency of all of this, but I also would like the commission to focus on the fact that when we issue our first subpoena, we better make sure we've got our I's dotted and our T's crossed, because we may well have to go to court to enforce the subpoena. I hope not. I hope we'll get voluntary compliance and not have to litigate it. But I just, one of the things that concerns me is that when we do this, we don't want to be shot down at the outset. So we need to make sure, maybe staff can help us do this. We need to make absolutely sure that when we do this, we're doing it right. And this is really not the way I wanted to start off. I'm not saying there isn't a reason to start off this way. It's just not the way ideally you would start this procedure off, because we have been given a very important, by the way, an extraordinary power, which the subpoena power is. We ought to use it, but we ought to use it wisely, and we ought to use it in a way that where we're upheld by the courts if challenged. Those are my comments.
Yeah, those are my concerns also. I mean, we are talking about exactly that, and there are other questions that we have not had answers to from the sheriff that are extremely important also. So there seems to be, we have a litany of unanswered things in the last few months, and we are very cognizant of that. Commissioner Ocean, did I see you wave?
Yes, so I appreciate what the Commissioner Bonner's comments, and I think I think your concerns are very valid. But at this point, we are in a pandemic, and we are dealing with the loss of life, and so I think we should task our staff with drafting a subpoena request based on the process that they're developing. We can work on narrowing the set of questions that we're asking. Unfortunately, we in many ways we don't have much to go on because the sheriff has not participated in our meetings. And I think in our last subcommittee meeting, I don't think anybody from the sheriff's department was present. So we haven't been able to get basic questions answered. And so this is unfortunately what we're forced to do. I do think they should come, we should have a time certain, which should be our next commission meeting. I also think it would be possible for us to do an emergency meeting, but at this point we do have a scheduled meeting. And so my suggestion is that we task our staff and the OIG, if the OIG is part of this working group, with defining the specific scope of the subpoena. But at a minimum, we should ask someone from the sheriff's department to present on the policies that have been implemented as it relates to their COVID-19 response, how they are managing housing with regard to CDC and health guidelines and so forth. So I think these are the questions that are coming up, and unfortunately I can't define them all right now in the motion, which is why I phrase it very broadly with regard to the policies that have been enacted as part of the sheriff's COVID-19 response. And then obviously we can ask for additional data if necessary.
So, Patty?
Go ahead, Commissioner Rubin.
Commissioner Ocean, would you be willing to amend your motion to direct staff to draft a subpoena? Because at this point in time, we can make a generalized statement. We are, we should subpoena the sheriff, we should subpoena documents, but as county counsel and as Max Huntsman has said, we need something specific. So it would seem to me, if you were willing to go along with amending your motion to authorize or direct staff to develop a subpoena and the grounds for a subpoena of the sheriff.
Yes, I would take that as a friendly amendment. Yes.
Mr. Huntsman?
I just wanted to point out that under the OIG ordinance, I'm permitted to issue a subpoena if directed to do so by the COC. So you do not have to set forth the details. I can work with staff on the details if that's what you want. And then I can issue the subpoena when Brian and I have put it together and we're good to go and we'll be ready for your next meeting. The way I would suggest doing it is subpoena the presence of the sheriff as well as whichever other experts he needs in order to answer questions that the COC has asked over the past year and a half relating to a variety of oversight issues, including COVID-19. I realize at some point we would want documents, but the most fundamental thing that hasn't happened throughout this process is the sheriff coming and engaging with the Civilian Oversight Commission. And that's provided for in your ordinance that he's supposed to do it, but he's not doing it. You've asked him to do it. You've asked previously for chiefs to come and talk about the discipline system. They refused. So I think this core request of a subpoena of not documents necessarily, but simply a person coming and engaging in order to testify before this commission, that's exactly an appropriate point for you to issue your first subpoena on. The ordinance has a mechanism to do it. So you don't actually have to do a complex motion setting if you choose not to. You certainly may.
I like that. I like that.
If I could,
Commissioner Bonner?
yes, I appreciate that, but I actually don't want, I think we ought to keep this narrowly focused, not every question we have for the sheriff. And so maybe the motion should be just that the commission, through its staff working with the IG, should issue a subpoena to the sheriff and his designees to testify before the commission at our next hearing, which is May, whatever it is, 21st of this year, regarding the policies and handling of the impact of the COVID-19 virus on in and on the county jails and the county jail system, without totally wordsmithing this. Let's just have them appear next. Let's just subpoena them to appear on that issue. And if we can gather some data and documents about what the policies are, that would be fine. But if we can't, let's just have somebody appear, presumably, and let's direct it to the sheriff. That would be my motion.
I'm happy. I don't know if you're fine with that, Rob. I'm happy to take that language. It's not a problem with the county council. I'm happy to take that language and substitute it for my official motion.
Yeah, that's fine. If I could get some clarification, is the motion to direct the COC staff to issue the subpoena or to issue it through OIG?
We're voting to issue the subpoena right now. We're voting to issue the subpoena as I just described it. That's the amendment to the motion that's been accepted by Priscilla Ocean. That's what we're doing. And if there's a majority of the commission for it, then the subpoena should issue, period.
And I'd request that you direct serve it because, as I say, our ordinance provides for me to have that power at the direction of the COC. And I think that puts us in a legal position where we can rely on the ordinance for that authority. As an alternative authority, we also have Measure R, but that hasn't been tested yet. So I'd request that it's fine for the COC to issue the subpoena and ask that I serve it.
Madam Chair, if I could just add one thing. I want to note that we wanted the sheriff to appear here today as well because of his proposal to close the Altadena and the Marina Del Rey stations and some of the other critical functions of the sheriff's department. So if we fashion our motion so specific as that he arrives here and is not willing or able to discuss those issues, we may be shooting ourselves in the foot. So I just want us to consider that as well.
You can always request them to be prepared to testify on other issues, but I think we should limit the subpoena to the critical and urgent issue that's been raised by Commissioner Ocean. And but you could always request the sheriff, you know, when he's here, tell him we're going to ask him some questions about the budget issues as well. But let's not subpoena him to testify on those issues, because that's not urgent right now, as I see it. And I would want to give that further thought.
Yeah, I agree. I think we should keep it focused on COVID-19. And if the sheriff can answer additional questions, then we should ask. But I agree with Commissioner Bonner, and if we can use Measure R, I understand that hasn't been tested, but so if we need to direct the OIG to issue that subpoena, I think if we're on better legal ground, then we should do that.
Agreed.
Yeah, I'm in agreement with that. And could someone, for the public who's watching and listening, explain what we're about to do and how long will this take? At what point does it go to courts? Can somebody just do a brief explanation? Maybe that's the county council, so that I want the public who's paying attention to understand exactly what this means.
Well, Patty, let me just say before county council, we hope this doesn't go to court. We're going to issue a subpoena. We hope that the sheriff will just voluntarily comply with the subpoena and not test it in court. If he does, he does. But that's why I want to keep it limited. So only if it's contested, then could be literally, let's say weeks, certainly weeks, but maybe months before we get a resolution from the court as to whether or not we can compel the sheriff to essentially provide a statement or testimony on this issue in front of the commission.
And can I also say that I think if the sheriff does contest a basic request to provide information about the life-saving measures he and his staff are taking, that says a lot about the sheriff's priorities.
Exactly, but I really want the public to understand that if indeed it's resisted, this could take weeks or months. That's all. I just want that to be out there. Hopefully that's not the case. Hopefully the fact that we're so serious and are about to issue a subpoena to get this testimony and information to us, and to remind the sheriff that this is a public forum. When the sheriff doesn't come to speak to us, he's not speaking to the general public. All our commission meetings are open to the public.
And if I can just say one thing to echo Commissioner Bonner's point, if the sheriff decides not to comply, he can either file a motion for a protective order to quash the subpoena and go to court himself, or he can simply not comply, and then the commission's choice will be whether to go to court to move him to compel, because it's not a self-enforcing subpoena. So if he doesn't comply, either he can go to court to block it, or if he does nothing, the commission can decide to go to court to compel him to appear.
I want to bring up one thing, that we have 100 people who want to speak on the issue of the closing of the stations and the sexual assault programs. 100 people to speak on that. So I'm just bringing this up as we talked about adding some questions into this about him speaking on other topics. How can we frame that so that it does have the impact that we want? That the issue of the closing of the stations and these other programs are of great concern to the public.
Can I just say, I really hope that we'll vote on the motion as Commissioner Bonner stated it. I hope that in sending this subpoena, that it will also send a message that we're prepared to subpoena testimony on other issues. So hopefully we won't have to go through this again, because we can signal that we're willing to use the power that we've been given by the people. So I would like to keep our motion narrow. I'd like us to focus on COVID-19 and direct the OIG to subpoena the sheriff. And if we could vote on that motion, I think that's great.
Very good. And I wanted the public to know that we're also hearing them on these other things. So if there's no further discussion, we have a motion Is it understandable now to everyone what we're voting on? Has that been restated?
Commissioner Bonner, can you read your language, please?
Yes, the motion would be to issue a subpoena to the sheriff, including his designees, to testify before the Civilian Oversight Commission at its next regularly scheduled meeting. Insert the date, I think it's May 21st. And that we would be requesting that the IG be directed to issue and serve the subpoena. Excuse me, it would be regarding the sheriff's policies and handling of the impact of COVID-19 virus on the county jail system and its inmates and custodial personnel. That's the motion.
That's the motion. And we have a second for that motion. Commissioner Vera,
Yeah, I second.
everyone in favor of this motion, subpoena the sheriff, please say yes.
Yes.
Yes. Yes.
Yes. Any opposition? Any abstentions? Some unanimously passed. And the staff will help draft, and it will be served by Mr. Huntsman. Okay. Thank you all. Okay, deep breath, everybody. We are now, as I mentioned, we're skipping the break. This has all been very important. I regret that we don't have more time, but we're going to move to our next agenda item, which is, find my place.
The Measure R item.
Discussion regarding COC plans to be in compliance with Measure R plan requirement. And we have, as you know, a Measure R is passed by the voters, which also grants the commission subpoena power, as well as requiring the COC to develop a comprehensive plan to redirect its public safety investments from an all incarceration model to more service-oriented model. So Measure R we created a Measure R. I had a hoc committee made up of Commissioners Harris, Kennedy, Bonner, and myself. And we've started to outline our approach. And we've invited two speakers today. We have Patrice Cullors and Mariela Albergis to give us some history and outline some of the meaning and the work that has been done through Reform LA Jails and others on this very important topic. I believe Ms. Cullors is going to speak first.
Yes.
Welcome.
Thank you. And just really grateful for this conversation and really grateful to be working with this commission since its inception. I want to start off this conversation by congratulating the commission for exercising your power and moving the IG to use subpoena power to hopefully get us to get a conversation with the sheriff so that we can make sure that we're all on the same page and we can be moving our county and supporting the people inside the jails. Justice LA and Reform LA jails are constantly receiving calls from family members. Folks are scared. They're scared for their loved ones. They're scared for themselves. And COC was created so that we could have more transparency from the Sheriff's Department. So I just want to congratulate you all and thank you Priscilla Ocean, specifically for your courage to move on that, even though I know that this commission really didn't want to have to use its subpoena power immediately, but I'm grateful that you are. Measure R grew out of a decade of organizing to stop sheriff violence and abuse in the jails. Our campaign collected 250,000 signatures to put Measure R on the ballot. It was the first time and LA's history that the people took a criminal justice reform initiative to the ballot box, and it was the only second citizens initiative in LA County. We are powered by many groups across Los Angeles County, but also groups across the nation, groups like Black Lives Matter and Justice LA and Dignity and Power Now. Many groups showed up to ensure that Measure R became law. On March 3rd, the voters of LA County showed their resounding support of this measure. We obtained the support of 72.8% of LA County voters, accounting for over 1.3 million votes. There were people who voted for Measure R more people than all the top 4 presidential candidates. So we understood going into this campaign that folks in LA County for decades have been desperate for reform inside of the jail space, but also and the larger criminal justice space. The campaign was a collective victory was secured with the support of over 100 endorsements and a community coalition of 13 organizations. We knocked on doors and made phone calls to nearly 140,000 voters. We held 83 events across LA County and had over 2,000 volunteers sign up for a volunteer shift with the campaign. And I will pass the next set of slides over to what is Measure R to Mariela. Thank you for letting me give sort of the framework for Measure R.
Hi, good morning, everybody. Mariela Alburjes here, Director of Implementation for Measure R for Reform LA Jails. Again, I want to echo Patrice's sentiments and our great appreciation to be able to enter in conversation with the COC with regards to Measure R. And I definitely do want to uplift the courageous step that the COC members made today with their motion in terms of proceeding forward with issuing a subpoena against the Sheriff's Department. So I want to uplift that, and I thank you in advance. So again, what is exactly Measure R, right? We have heard, and there have been, so much committed efforts in order to make this be a reality for us. And so now we have to understand it. So Measure R is an important step towards fixing LA's broken jail system. It focuses specifically on addressing issues of transparency and accountability over the Sheriff's Department. And then, of course, also demanding a special focus on addressing the severe overcrowding and inadequate mental health care and services that are within our jails. In addition to that, as we all know, it also supports in strengthening the power of the Civilian Oversight Commission in order to be able to fulfill their oversight function over the Sheriff's Department. In addition, it also emphasizes, it has particular focus on decarceration, of course, and then also in terms of, identifying cost savings and the best way to be able to invest those in vetted, efficient, and accessible community-based treatments and services. The measure does have 2 primary objectives. The first of which we have a lot of a conversation around, of course, is that it does grant the Civilian Oversight Commission with subpoena power, right? And this is in order to effectively and, of course, uphold the independence of the commission in order for them to be able to investigate any misconducts, request audits, and any other means of necessary in order to be able to monitor the Sheriff's Department. In addition to that, the Measure R also allows a period of 7 months for the county to be able to develop the public safety community reinvestment plan, and then also to conduct a feasibility study as to how the best way to be able to reduce the jail population and then also be able to reinvest savings into treatment. We do want to uplift that, in terms of that point of the, the plan of the feasibility study, it is important that in this process, it is prioritized that the reinvestment of into any services is actually done towards those services that are vetted, effective, and again, accessible to the community in terms of treatments and programs with the ultimate aim of decarceration. And I think that's something that we definitely need to keep at the forefront as we proceed in this process. So of course, it's been a long road to get to this point, a great deal of community effort. The voters have spoken, right? Or like Patrice mentioned, 1.3 million voters said that this is the way that we want to be able to conduct business and support the COC in order to be able to do so. So the voters have spoken. So I say that in order to highlight the fact that we're no longer in a campaign process, right? We're no longer, in that type of engagement. We're focused more in terms of really building a partnership in order to be able to strengthen and best support the COC in their mission. We recognize that the implementation of Measure R is not a small responsibility, and we do honor the fact that the COC is taking such an intentional approach in order to be able to learn more about the measure and find the best way to be able to implement that, right? But we want to uphold the fact that this is actually an opportunity to be able to create a sustainable plan that really does, focus and reflect the priorities of, residents and, voters throughout LA County. Again, I want to uplift that we're so grateful to be to this point because of the decade plus of advocacy efforts that have been led by dedicated community members and organizations. I do want to uplift again, like the work that has already been done as a result of these efforts. One in particular, of course, is the Alternative to Incarceration Work Group. We definitely believe that the process of implementation should actually be committed to building upon those foundational recommendations and resources in order to be able to support the process of continued decarceration. In addition, we recognize that there are needs for connecting the commission to certain resources, to certain experts. And we want to, again, reiterate the fact that us as Reform LA Jails, our coalition, and our extended partners throughout the community are actually really committed to be able to serve as resources and partners in best facilitating your process. Again, we recognize that this is a process that has been, taxed to you by the voters of LA County, and it is a huge responsibility. So we want to make sure that you hear from us that you're not alone in this process, and we want to be able to support you in, facilitating this in the best way we can. Some ways in which we have actually started building out and organizing ourselves within Reform LA Jails in order to best support your process as the commission is by making a study as to like the different reports. Like I already mentioned, the ATI report and the beautiful recommendations that come with that powerful document. Of course, we also have to contend with a Board of Supervisors motion, in addition to other things. So what we've actually created is like a matrix that's currently in development, and we do hope to be able to share it with you very, very soon, in which it breaks down the specific, portions of the measure and actually connects them with ATI recommendations, the Board of Supervisor motions, in addition to other resources that are leading the conversation in the field with regards to, this issue. And we do hope that the matrix will provide you some guideposts and kind of like a snapshot as to what to consider for which parts of the measure. And then, of course, as we continue to engage with our stakeholder roundtable, which is, something that we're beginning to convene. This roundtable is, composed of a number of key leaders, visionaries, active decision makers that have actually for a long time been involved in this conversation. And so we want to make sure that there is a body to be able to convene and be able to hold that knowledge in order for the COC to be able to leverage it for their purpose of, to be able to facilitate this process. In addition, of course, like I mentioned, there are so many resources out there. So what we have been doing is doing a careful mapping of readings, reports, et cetera, that, will be able to best serve that of the COC's process. We think that it is important to really know what resources are out there and how to be able to, apply and leverage them through this implementation process. And then, of course, first and foremost, really upholding the, the knowledge, the expertise that is held at the community base, because we know that without community voices at the table, whatever is recommended, whatever is implemented, cannot be sustainable. Lastly, I know there is a lot of conversation with regards to, subpoena, how to be able to, execute that, who should be able to take the lead. And we have heard those questions that have been raised by the members of the commission. We uphold them, and we are doing our best to be able to provide you with information, briefings, research, et cetera, in order to be able to provide greater clarity as to that. It is just a matter of when you're ready to be able to receive that information from us. We are ready to be able to share it with you. And again, I am grateful that in this conversation today, and also the conversation earlier with regards to the response of the sheriff departments with regards to COVID in the jail, the need to be clear as to that proceedings and what it entails is urgent. And so we're here to be able to support you in providing any of that clarity and working with county council to be able to do that to best serve this process. So now again, in the time of COVID, right, we recognize, and I am reiterating a lot of the points that have already been brought up in, the previous conversation, but we recognize that, yes, not many of us or not any of us have actually, survived the pandemic, such as the situation with COVID-19 at the moment. But we recognize that the moment is unique, but it's not unique in terms of the public health issues and violations that for decades, community leaders, electeds have actually been, challenging. So in our vision, in our opinion, COVID does not necessarily shift stuff. It actually further exacerbates and further amplifies these pre-existing conditions. And so that's why it was so important for Reform LA Now, at LA Jails, in collaboration with our partners, committed partners such as Justice LA, Dignity and Power Now, Youth Justice Coalition, and over 40 plus local and statewide organizations that made the decision to come together and launch the Justice LA COVID-19 response team. The response team that has been active since the beginning of March continues to challenge the leadership of LA County, forcing them, demanding that they take immediate action to protect the lives of the incarcerated people. We recognize that those within, prisons and jails are the most vulnerable during this global pandemic. And it's important to be able to make sure that, as one of the one of the people that made public comment before really uplift or something, they mentioned that a jail sentence should not be a death sentence. And so we do definitely believe that the time to act in the protection of our incarcerated brothers and sisters is now. In addition, when we protect those that are on the inside, of course, it has a ripple effect of protecting those that are on the outside. I appreciated the comment that was also uplifted as to the issue not just being with regards to, protecting and assuring the safety and well-being of our incarcerated people, but also, protecting against, any potential transmission. So, we ask, and again, I want to uplift again the courageous step that the COC took today in demanding that the sheriff come to the table. We are also very concerned about the lack of receptiveness that has been continued to experience on behalf of the sheriff. And the time is now to have these, questions, these points of clarification, this data provided, in a timely and urgent way. So in terms of recommendations for COVID-19, there are a few things that we do want to uplift for the consideration of the commission. First, we do strongly recommend that the COC immediately leverage the rights that are under the responsibilities that are under the Civil Brand Commission in order to be able to go into the jails facility and be able to inspect them without the approval of the sheriffs. The Civil Brand Commission focuses specifically on upholding best practices to be able to secure the safety of men, women, and children, that are impacted by incarceration. And so we believe that the time is now. We recognize that there has been information released by the Sheriff's Department. I want to honor the updates and the insight that was provided to us by Judge Espinosa, of course, by IG Matt Huntsman, in addition to the Director Commissioner and Dr. Clark. However, in our experience and from what we've heard from many testimonies from incarcerated people currently serving time on the inside, or family members and loved ones, we recognize that whatever information is being provided as to now only gives a snapshot of the realities. We're well aware of the limited testing, the lack of supplies to be able to protect ourselves, and be able to assure appropriate hygiene. So our biggest concern is that, the information that's been provided is great, and we honor the efforts. However, at this point, it fails to be enough. So what we do recommend again is for the COC to ascertain some of this following information with keeping a priority. And I think first and foremost, we do need to focus on this, is that as we already mentioned, many of the recommendations by the CDC, the California Department of Corrections, LA County Department of Public Health are not being honored. And even those that are being honored, like they can't fully be implemented because of the issues of overcrowding, et cetera. So we recognize that this is a big moment and a big responsibility to be able to create a great, great impact. And again, we want to make sure that we work in alignment, that we continue to be in communication to be able to assure that we all are fighting to be able to save lives, both on the inside and on the outside of our prisons and jails. So, we do ask that, again, there is an immediate issue of the recommendations to the Sheriff and the Board of Supervisors that calls, again, for a continued depopulation of the jails and wide testing of all incarcerated people, not limited to, of course, those that are experiencing symptoms. And we think that, again, the moment is now to be able to exercise that for in the name of the lives and the well-beings of, the people throughout LA County. And then also, this is also an invaluable opportunity to really test the might of Measure R. We recognize that it's the first time that it will be, fully tested out, but we think that this opportunity is essential and a fundamental one. The urgency of the matter, I appreciate, again, Commissioner Ocean uplifting that 1 week may be a little too much because of the number of, casualties and, deaths and transmissions that continue to persist. So we do, again, uphold the decision, and we thank the commissioners for moving forward with this. And we do, again, want to urge the need to actually be very quick and with great expediency, even though with great intentionality in the lives, in the name of the lives of our brothers and sisters, both within and outside of the jails and prisons. So with that, I open up the floor for any questions and comments that may, come from the commissioners.
Thank you very much, both of you, Ms. Cullors and Ms. Albergis, for this presentation today. So we're going to open it up for some conversation. I just want to point out we have a time check. We have about 15 minutes left for this meeting today. So I think I saw Hernan first, and then I saw JP, and we'll move on from there. Go ahead.
Thank you, Madam Chair. Thank you, Ms. Collis and Ms. Arbujes for the presentation. You both are national leaders, and we're lucky to have you working with us on this. I'm intrigued by the Sybil Brand recommendation. So I guess it's a question for Brian and County Council. Can we enlist them? And if not, as an order, which I would think we might not be able to do, it's an independent commission, but is there any way that we can enlist them to help us in terms of inspections, or is that commission power sort of defunct? I thought that there were some limitations on that that were imposed a while back.
There was a recent change in the ordinance which greater establishes a relationship between the Sybil Brand Group and us. And so we can request that they do some inspections on our behalf. And in fact, we just met with them just this past week. So we'll forward that request onto the Sybil Brand Institute to do those inspections for us.
Great. Thank you.
Ernan and I were thinking along the same line, so I'll pass.
Carlson?
And I guess I would follow up on that is if we can also ask the Civil Brand Commission, to the extent that they have done any inspections, and I saw just on like Facebook or Twitter that Susan Burton and a colleague inspected CRDF recently. So it'd be great to get a report back from them about what they saw, so that that can inform our ongoing discussions. And I also want to let folks know that in terms of some of the questions that were raised by the presentation about just the numbers in the jails, the number of people who've been released, the number of people who are medically fragile, those are questions that we've been asking as part of our ad hoc committee under the leadership of Commissioner Rubin. So I want folks to know that we are actively trying to chase down information on some of these figures. They're constantly changing, and in some cases it's just not available, which is another question that we're asking, which is why aren't some of these areas being tracked more appropriately?
Commissioner Harris?
Yeah, just a little more follow-up on the SBI thing, and maybe Mr. Huntsman can help us with this. Your staff is continuing to make inspections of the jail at this time. Is that correct or not?
Just me. I'm not sending my staff into the jails because of the transmission issue. They're certainly active. They're a lot of video review in order to establish important issues regarding treatment in the jails, whether or not care is taking place. They're doing a lot of interaction with the Sheriff's Department and gathering information along the lines of what Commissioner O'Chin was talking about. But I'm the only one who's going into the jails. Kathleen Belt's my assistant, who works on custody specifically as well, but I'm trying to limit the potential for transmission. So I do it pretty much personally. So I'll be going, or Kathleen may be going next week up to Pitchess, and we do that. But we have been fielding lots of complaints and monitoring, but we're not doing the normal non-COVID approach, which is to go in, walk up to or walk into cells and talk to people. We're trying to avoid that as much as possible at this moment.
All right, I appreciate that. Thank you.
Can I just get a quick clarification of what the Civil Brand Commission is?
If you'd like, I can address that. Sybil Brand was a great personage in jail reform, and was there's a jail that isn't open at the moment that named after her. And the Sybil Brand Commission was created in order to do a lot of the things that the CCJV was created for, that this body was created for many, many years ago. And they created a commission, and they have a set of commissioners who are appointed by different board members who are highly motivated and care about the conditions inside the custody environment. And they have been doing inspections for many, many years. It's sort of a model that was created, different than the model we have now. And so it became a little old-fashioned in a way. And this, I think, what we're seeing now is an attempt to kind of rejuvenate it in a new world where we can get all these people, such as Susan Burton, who are highly motivated and very knowledgeable, get them on the ground and involved, and then align them with you so that we can all be working on the same issues. Because over the years, since my office was created, we've worked with them periodically where they'll observe something inside the custody facility, and then we'll go do follow-up on it. So we're hoping that we can have a kind of a synergy between those two commissions, because otherwise the LA County has a lot of commissions and people sit around and talk about stuff and learn things, but how do we get action out of that? So that what you're seeing is an attempt to keep something going that has existed for a long time and sort of modernize it.
I see Commissioner Bonner. Thank you, Mr. Huntsman.
Yeah, I would ask Max, I mean, isn't the Civil Brand Commission, isn't it though essentially duplicative of the COC and the IG and our functions? I mean, why do we, there's a point where you have to ask, why do we need so many commissions and why do we need this commission? But if you have a short response to that, I'd be interested in hearing it, and we could also talk about it offline. But
I mean, you're absolutely right. We have a lot of commissions and there is overlap and it is duplicative. Whether or not that's a bad thing or a good thing depends on your opinion on that subject. And the current approach that came from the board through our ordinances is we don't want to get rid of this commission. We want to try to incorporate it in. Whether or not that will work or how effective that will be or if it's efficient, I can't say, only the future will show.
Thanks.
Commissioner.
I guess that was my concern is, I mean, one commission directing another commission to do their job. It just seems very odd.
Well, once again, under the new ordinance, we have that relationship, whereas we are able to request those inspections from the Civil Brand Group.
Maybe we should have that ordinance sent out to us so everybody can review it,
Sure, we'll send it out.
if you will. Commissioner Ocean.
Yeah, I just want to say one way that the Civil Brand Commission is not duplicative of the COC is that we don't have the ability to make unannounced visits to any and all of the facilities. They do. So in that way, we actually, the relationship is synergistic, not duplicative. The other point that I want to make is that I hope that either the OIG or the Civil Brand Commission will pay special attention to NCCF, because we have roughly, out of the 3,000 and some odd people who are under quarantine or isolation, a third of them are at NCCF. And so I hope that we will look into what's happening there and what precautions are being taken by the Sheriff's Department. In addition to CRDF, which is obviously the women's jail, and to make sure that the special and particular needs of women are being addressed. And this is particularly true given that there are fewer people coming in and out of the facilities, rightfully so, but that can often mean that there's more of a likelihood of other kinds of violations, other kinds of dangers beyond COVID-19. We know that people have been arrested, staff has been arrested for sexual assault and so forth. So there are other issues that have a danger of occurring because there are fewer people coming in and out of the facilities.
And we will do that. We'll go up there, and Ms. Belts or Ms. Belts will go up there. We'll have our staff prepare information so that hopefully when we subpoena the sheriff and he comes to address these questions, you'll have good information to ask him questions with.
And thank you for all of your work, Max and Katie, for your work in going into the facilities. I know that, it's putting you at risk, which is how we know that the people who are being held there are significantly much more at risk than any of us going in and out of the jails. But I know that there's a risk, so I thank you for doing that.
It's an honor to be able to go there and, and put myself a little bit at risk. And as you point out, the people who are actually there, both staff and prisoners are much, much greater risk. And so I don't feel put upon, and it's an honor to be involved.
Any other comments? Okay, again, I want to thank our presenters today, Ms. Cullors and Ms. Albergis, for coming, and your offer to partner and to help us with resources as we have a lot of heavy lifting with the COC going on right now. So thank both of you very much, and we will definitely be in touch with you, and we know you'll be in touch with us.
Thank you so much, Patty. Thank you, everybody else.
Thank you to everybody.
And so we have to end our meeting. We're coming to our close. I have two administrative matters that I would like to attend to. One is I would like to go back to the approval of the minutes. I'm sure everybody had a chance to read the minutes of the last meeting. Can I get a motion to adopt?
So moved.
And a second?
Second.
Commissioner Ocean, everyone in favor?
Aye.
Aye.
Any opposed? Okay, thank you very much. We took care of that housekeeping. Now, unfortunately, we're not going to be able to have any time for public comment, and my deep apologies to the people who were waiting, but they're going to shut us off on this platform in a couple of minutes. So my other matter, we did a lot of heavy lifting today, and we have a meeting on the 21st. I would like to suggest that we do a full 4-hour meeting at our May 21st. Right now, I believe it was scheduled from 9 to 11:30. According to the tech people, we're also at the mercy of the technology people about how they're, everybody's on these virtual platforms now. So they're suggesting from 8 to 12 on Thursday, May 21st. So we could extend our meeting that day. We have a lot of business to attend to. Would that be agreeable to everyone?
Patty, if I might, I'll do whatever the will of the body is, but I'll be frank, that's an awfully long time to be on a video conference. Given, as has been pointed out numerous times today, we are in the middle of a pandemic. This is an emergency. I would not be opposed to, if we need to have 4 2-hour meetings a month, i.e. one a week, and they don't have to be on the same day, they don't have to be at the same time, I'm thinking we might get a tremendous amount accomplished, and it might be more productive to do that than to try and get it done in a 4-hour meeting. But that's just my opinion. I will go with whatever the will of the body is.
Okay, well, the will of my body agrees with you that being on, and many of us are on other meetings. This is where, we're all at home right now, and that's how we're conducting our lives. So we're on a lot of these screens, and it is not the best thing. However, the fact that we have subpoenaed the sheriff, we have to continue with our other items that we have not been able to get to. And I really want to make sure that we figure out so that we do have more public comment at the next meeting, because there are 100 people who did not get to speak today. Not that we would have gotten to all of them, but none of that lineup of 100 got to speak. So I would suggest that, and I would promise you a break in between. We'll take a 10-minute break or so. But that for that next meeting, let's do since tech can do from 8 to 12, let's do that. We'll consider how we move forward, and hopefully not do a 4-hour meeting again. But it seems to me that the urgency of what everybody has been talking about today, and the issues that we're dealing with, that we probably should bite the bullet and, pardon the phrase, but have a 4-hour meeting on the 21st.
If I could just follow on, I agree. But if we were to go to 4 shorter meetings in a month and 1 a week, I would suggest we do a single agenda item on those meetings. That way you have ample time for the public to speak on a specific item. We could do 4 agenda items in a month. Frankly, that's more than we normally do when we had our single monthly meeting. And I think the public would be well served that way, because people will know on this particular day, this is what we're going to talk about, and we'd get people very specific on their public comment. But then again, just a random comment, that's it.
Put that suggestion under advisement, but I know that then causes issues of scheduling for all the commissions, all of our commissioners. So, but we hear the suggestion. So is everybody in agreement for the next meeting to go from 8 to 12?
Yes.
Yes? Okay. Okay,
Patty, if I might, may we also suggest the possibility of doing an emergency town hall meeting, which takes us out of some of the Brown Act rules, and it perhaps will give us a little more time to hear from the community.
That's a very good idea. Do that separate.
Correct.
Do that separate, and it would be mostly about hearing from the community.
Correct.
Yes, that's a very good suggestion. So let's entertain that one also.
Can we also give some preference to those who signed up and couldn't speak today? I don't know how we can do that. Make sure that they get to speak properly the next time we meet if they want to. I don't know if there's a way of doing that, but I would suggest something like that.
Yeah, if that's possible, we can check with Jennifer. I don't know how, if we can hold people over and if they'll,
Yes, we can. We can.
Okay. Is there a way that you inform them, or you tell them that right now?
I will collect all of the email addresses of all of the folks, and then we'll be able to advise them when we are going to do the town hall that Brian mentioned, so that they're aware of that and that their emails will have first preference for comment.
Okay, very good. Okay. Any last commentary from any commissioners before we close? Commissioner Olson?
Yeah, I just wanted to reassure people that just because we won't have a meeting for the next 2 weeks, it doesn't mean that we're not actively engaged on the COVID-19 issue or any of the other particularly that issue. As was mentioned earlier, we have a subcommittee, and we are, emailing, we're meeting, and trying to get as much information as possible.
Yes, thank you for that to remind everyone. We're pretty busy. We are a very action-oriented commission. I know there are a lot of commissions out there, but ours is pretty busy, pretty active. And we also have other ad hoc committees that are poised to bring their issues forward, and I want to make sure that we do that. Obviously, we're in exceptional times right now. But we'll figure it out together. We'll figure out how to be present with each other, do the public's business, and hopefully be able to actually exercise oversight of the sheriff's department. Yes, Mr. Williams.
Just a quick thing for the members of the community who wanted to provide a comment today. You can email those to us at cocnotify@coc.lacounty.gov, and we will make those part of the official record. We'll also place that on our website as well to gather that information.
Oh, that's an excellent idea. Yeah, I would second that recommendation to the folks who are not unable to speak today. We are very interested in your commentary. Please email your questions, your commentary, your life experiences, and we will pay attention to them. Any other?
One last announcement. Today is our staff member Christina Kay's last meeting. So publicly thank her for the just tremendous job that she's done. She's really been with us since the beginning of what we've been doing here, and her presence has been felt, and it will be missed. And wherever she goes next, I'm sure she's going to make quite a bit of impact. So thank you, Christine. We love you, and we are going to miss you.
Let's applaud Christine. Yes.
Here.
She will be missed. She will be missed. Christina was a tremendous asset on all the ad hoc committees that she worked on. So Christine, we wish you very good landing in your next position, and make sure you stay in touch with us. And again, thank you for all your work. Any other announcements or comments? Right. So we are adjourned. Thank you all very much. Thank you, public, for tuning in.